Okay, so this patient walks in today, and he's carrying a big, thick book, right? And the book is titled, like, Crooked, the Healthcare or something for Back Pain. And, you know, he asked me if I had ever read the book, and, you know, no, I haven't read the book yet. It's, see, I'll put a link to the book here in a second. It's called Crooked, Outwitting the Back Pain Industry and Getting on the Road to Recovery. It's actually, I thumbed through it real quick, and it was a really good book. So, you know, the patient walks in, and he's like, hey, what do you know about the McKenzie method? And I'm like, awesome. I got patients throwing me softballs. And so, you know, I went through and I started educating on the McKenzie method. And, you know, he's like, oh, okay, that's cool. And, you know, he brought the book with, and, you know, I didn't really get to see the whole thing yet, but I saw that he had read the book. And, you know, obviously he's on his, like, second reading of the book because there's different colored highlighters in the book, you know. And then he goes, what do you know about Stuart Mcgill? And I'm thinking, all right, awesome. You know, throwing more softballs. And then he goes out to cite some of the stuff in Stuart Mcgill's book about, you know, the assessment being the most important thing, how, you know, abdominal bracing is important. And I'm like, man, I love this guy already. You know, it's, and you know, I had to follow that up because I've actually emailed back and forth with Stu a couple of years ago. And so I'm like, all right, you know, I actually have a personal connection with Stu, Dr. Stuart Mcgill. Sorry, but, you know, he goes by Stu. And so, you know, that seemed to have satisfied the patient. And then he asked the next question, do you know a guy by the name of John Childs? And I'm like, boy, this guy's done his research before coming to therapy, you know. And I gave him the salute sign, you know, and he didn't quite understand it. And I'm like, well, you mean Major John Childs? Yes, I was lucky enough to have a conversation with Major Childs years ago, back I think in Baltimore, when he came to the MDT conference. So this guy's throwing out some heavy hitter names, you know, and then he's asking, well, what do you know about long-term use of opioids? And mind you, this guy's a layman, right? He's not in the medical profession, but he's read a lot, obviously. The point of this is, if you're not well read and you're not doing your research and you're not keeping up, they're gonna come in smarter than you are. Right? We have to make sure that we're staying up to date on the research. We have to make sure, hey, what's going on, James? We have to make sure that we don't let the patient be the smartest person in the room, because that would be a big mistake on our part. I was able to gain this patient's trust within the first couple of minutes of our session today, because not only do I know what he's talking about, oh, mind you, this guy has been to therapy previously in the past. He's been to a couple of the big box clinics, and he's actually been to a smaller clinic out here, a private practice. And he did his research on me. And, you know, he looked me up, Dr. Dukes, what's going on, and he found that, you know, that I'm actually certified in the McKenzie method. So just know that patients are getting smarter, and we can't hide behind fear-mongering. And we have to make sure that we're doing our best to build ourselves up and to build up the profession, because patients have access to the same information that we do. And here's the kicker, right? They have a personal investment in their problem. And so if we're going along and we're just, you know, shake and bake and, you know, just check box and, you know, we're going to run into problems with the public, and we're seeing that. By the way, I'm giving a public lecture today in the next 35 minutes, so I'll be out about in the town and answering questions and, you know, trying to raise the profession. But I guess the moral of the story, don't let your patients be smarter than you are. Have a good day.